Now that we're ready to go through our cross-sectional imaging, we're going to start with the soft tissue window and do our outside-in approach. And what I like to do is have my axials on the left here. I use the soft tissue kernel. This particular series that we have is a little bit of a thicker slice, 3.75, but you kind of want that medium thickness slices when you're looking at the soft tissues. And then here I have my sagittal and then my coronal just for co-localizing purposes. We'll start at the top of the head. And the approach that I take is to go in quadrants. So I'll start with the anterior, then I'll go lateral, then I'll go lateral on the other side. Then we can do posterior, and we can cover all of our bases. So as you're looking, we're just looking along the anterior surfaces here. And as we scan up and down, we are looking for any signs of trauma, any collections. This is the galeal aponeuroses. This is connective tissue. There can be hematomas that are either above this level or between this and the periosteum of the skull. So you just want to take special note there and just make sure that if there are any signs of trauma that key you into what's going on, that can be very, very helpful. What's helpful too is if you see signs of soft tissue damage, it can make you take a really close look at the bones underlying these soft tissues, and then also the brain parenchyma that's either underneath or adjacent, so you can look for hemorrhagic contusions or other intraparenchymal brain injuries. So as we kind of scan down, it's very helpful to look at the orbits as well too. This is part of our soft tissue search pattern. You can look for foreign bodies. You can look at the optic nerves here. You see the muscles of the of eye movements here too, medial and lateral rectus muscles. You can appreciate those on both sides. You can see inferior and superior, especially if you're looking at different views. So you can just take a close look there as you scan through the orbits, and then also you'll see the lenses of the eye here too. Not abnormal to have a little bit of air around the orbits like we're seeing here. We actually see it on both sides, so that's okay. But those are all things you can appreciate on the soft tissues. And then as you scan down too, it's important, you can put this at any part of your search pattern, but I just do it with the anterior part. You just take a look at the pharynx here as well, and you can look and see, you can look at the tonsils. Just make sure there's no tonsillar abscess or pharyngeal abscess, retropharyngeal abscess, or other masses. Malignancy can hide out back here in the pharynx, and depending on how low you're going, the hypopharynx. So you just want to make sure you look at the soft tissues here, and that's not a blind spot. You can also see the prevertebral fat, depending on how low you go. So that's something we do a little bit more on the cervical spines that we look at, to look for prevertebral soft tissue swelling. But depending on how low you go, you may or may not be able to see that. Once we've gone to the bottom and looked at kind of our anterior surfaces, you can come over to the lateral side, look at the soft tissues, and come over to the lateral side. It's a little subtle, but the density changes here. This is subcutaneous fat. This here is actually the margin, and this is the parotid gland, right parotid gland. You may catch some of the submandibular gland depending on how low you go. But you just want to make sure that this isn't a blind spot for you. So you can look at all of the soft tissues here, including the parotid gland or any lymph nodes that may be present. And then you can scroll up, just again, looking at the soft tissues, looking for collections. Here we see a little bit of air, it looks like. So this could be the sign of a little laceration, a little bit of trauma. Maybe there's a little bit of skin thickening and swelling here. So that kind of can key us onto maybe this is the area of a head strike or head injury. Come up to the vertex, and then we can go down the other side, looking at the soft tissues. Similarly here, coming all the way down, now looking at the parotid on the other side. So again, this is subcutaneous fat density. We see it kind of subtly changes. This is the parotid gland here. We want to make sure we don't miss anything. And if this is kind of where you feel better about looking at the pharynx, hypopharynx, you can make this as part of the lateral portion of your soft tissue search. Just make sure you look at the tonsils and kind of these areas here, the musculature back here. Make sure you're not missing anything. Now that we've gone through both sides, we can look at the posterior soft tissues. This can be an area for head strikes or for pathology to hide out. So just take a look here and you can scan up, make sure that there's no hematomas or collections or lacerations at the back of the head. And then finally, again, depending on how much of the spine you get, you can manually window this a little bit and take a look at the spinal cord. And depending on how much you can see, you may or may not see that much. You can look for any evidence of something that's kind of going into the spinal canal, disc herniation, epidural abscess. Again, just depends on how far down you go, but it's something you want to be thinking about when you're looking at the soft tissue windows. And at this point, we kind of looked at everything, but if we need to corroborate, we can look at our other orientations here.